who is a small business owner in my congressional district, and I've invited Steve to be my guest for the State of the Union address that'll be delivered by Donald Trump, is because his story, and he'll share it with you in a few moments, is really such a clear example of how folks in the middle class are just getting nailed by the affordability crisis, the explosive increase in everyday costs that middle class families and so many people are struggling with every single day. From my vantage point, representing my constituents, what I'm hearing from them all over the district is that the state of our union is angst-ridden. That's really what people are feeling every single day. Costs are out of control. Electric bill prices, electricity costs have increased. Healthcare costs, as you'll hear, have exploded. And I mean, people are really struggling to make ends meet. And Donald Trump promised on day one that he would bring costs down. Well, the opposite has happened. And the opposite has happened because he's levied tariffs that now have been declared illegal, which we knew they were, by the Supreme Court at the end of this past week. The average family in my district, from the tariffs alone, have been paying almost $2,000 more a year annually because of Trump's tariff taxes. Electric bills have gone up about $172 a year. And grocery prices, people are paying about $1,400 more a year in grocery prices because household costs have exploded all over this country. And it has to stop. We need to work together to make sure that we can make life more affordable. So I'll turn it over to Steve to share his experience, and we'll be happy to take any questions.
First of all, I'd like to thank you for the opportunity.
My pleasure.
Our costs have gone up in the household. Let's just say inflation has hit the household more than anything because of healthcare costs this year. My plan, which is a bronze plan with a $20,000 max, is $3,400 a month for a family of four. I've been shopping to probably get out of that pretty soon if something doesn't happen.
What was it before the premium tax
beforehand
credits?
The base plan was $800 less, but then I got the tax credit, and it was about $1,000 a month. So that was great.
So it tripled.
It basically, $2,400 more.
Yeah.
So again, you see how that affects the family. Obviously, with all the other healthcare costs, any of the costs that we have at home that we basically have to contend with. So we're shopping again. We're hoping, because I was hoping initially that this would be taken care of in January, and that we go back to normal operation, that we'd be done, and we wouldn't be talking about this right now. So at this moment, we're shopping for other plans in the marketplace, not the ACA, but in the free marketplace, and just trying to figure it out. And it's not an easy thing to do. When you're looking at healthcare plans, you're playing with a Rubik's Cube, basically, and you're trying to figure it out. But our overall costs have gone up. I've got 2 kids in college, and it's just, you're trying to figure it out. Whether it's at the business, you got to make another $20,000 more just to cover the expenses for the healthcare just alone, and at home. So just like any other family, I'm above that threshold under the ACA, so I'm in the gray area, and the tax relief plan helped us, and basically that's where we are right now. My desire is for Washington to try to figure things out, honestly.
Well, and what you just said, the tax relief plan helping you, at the same time, because of the Republicans' refusal to restore the expiring enhanced premium tax credits, the increase in Steve's healthcare costs essentially ate up whatever savings he might have gotten from the tax relief. Most of the tax relief went to billionaires that blew a massive hole in our deficit, and Republicans were focused on making those permanent and they did make those permanent in the Big Ugly Law, and they refused to extend the enhanced premium tax credits so that small business owners, families like Steve's, would be able to make sure that their life remained affordable. Democrats forced a bill to the floor in a very difficult political environment because even a handful of Republicans recognized that the explosive increase in healthcare costs were pricing people out of control, and that there would be a lot of people falling off the healthcare cliff. And so we forced the bill to the floor to extend those premium tax credits, and we passed it. And now it's up to the Senate to act. And the president could and should use his bully pulpit to push the Senate to take up that bill and send it to his desk, and he should sign it. And there's a lot of other things that the president should be doing, which I'm sure that we'll hear from him tomorrow. I can tell you, because I always get asked about, what I expect or would like to hear from the president. I would like to, but don't expect to, hear the president talk about the absolute need to make life more affordable for Americans, to bring costs down, to work with Democrats to do that, and many other issues, including ensuring that we can get the full Department of Homeland Security reopened, because we have to make sure that we don't have disruptions in government in order to enable the administration to continue their abusive practices when it comes to their detention of undocumented immigrants, and those practices have to cease. We have to make sure that ICE agents are taking off their masks, that they're wearing ID, and that they can't just bust into homes without a judicial warrant, like we ensure people have safety from in the United States of America. So we're happy to take any questions.
Sure. Steve, you're a small business owner. What do you do?
I'm in aviation. I buy and sell assets.
Aviation assets?
Yeah.
Okay. And what has changed as far as your spending habits now that you have this increased healthcare costs? Are there things you've had to change or?
Well, I mean, I honestly, as a business owner, you look at everything. So, we were thinking, well, we have a small office. It's a mom and pop, basically. And we're like, okay, why don't we just get out of the office and work out of the house? That saves you two and a half a month. Again, that covers my new healthcare costs. Telephones, this, that, the other, the house. Again, 2 kids in school, and I got to keep on paying those rents, so I can't do anything there.
You mentioned your windstorm insurance.
Well, yeah, we dropped it, honestly, because it went crazy. So we were, lucky enough to be good, we've been there over 30 years, so we paid it down, and we got windstorm eliminated, saved $12,000 a year, and, basically you just have liability. I think a lot of people are doing that. A couple of my neighbors did that, so, but, that just went from, in a year it went from $7,000 to $12,000 after getting kicked off with 2 policies. But I keep on going. But yeah, you look at everything all the time. And I was raised like that, and that's what I do. So,
Steve, with respect to your health insurance for your family versus your health insurance for your employees, do you provide health insurance for your employees?
it's mom and pop. It's me and my wife. So me, myself, and I,
Right.
basically. So we have 4 people on the policy, and that.
Do the 2 college kids, don't they get health insurance at college?
Oh heck no! I
Heck
mean,
no.
you pay to go to the
clinic
the
or something.
clinic,
Right,
but
right,
you're
right.
not going to get anything out of that.
Right.
So
there's no more health insurance for college kids these days?
No, remember, with the Affordable Care Act,
Right.
Young adults can stay on their parents' insurance
Till
until they're
27.
26 years old.
Right.
But, and in Florida, actually, they can stay on until they're 30, as long as they're Florida residents. But,
Right.
I mean, but the parents are still, I mean, they're, because with the Affordable Care Act policies, they can age rate the policy. In other words, they can account for the age of policy participants. That contributes to the overall premium.
basically, I have no buying power. It's just it's like somebody doing drywall install, or an electrician, or a plumber. It might be him and his wife as a company, and what are they doing? I mean, they're trying to figure it out. And again, I'm in that gray area where I may go, you know, over that cutoff line under the new setup, or which was the old setup. But, you know, again, the policy has gone, just the policy, $800 in 1 year. And it's for, instead of 5 people, well, actually, no, we had 4, but it's for 4 people, it's gone up $800. And it never went up $800 in a span of 5 years, because, you know, I looked at all my numbers, I could ask my accountant what we've been paying, I pulled everything out, and I'm like, oh my gosh, it's $800 in 1 year as opposed to 5-year span, any 5-year span. So, I mean, who's gonna answer that question? When I was at the office renewing, I asked the guy what happened, you know, why $800? And he's like, well, our cost went up, or whatever. You know, they can't answer it. So I'm like, but that's, you know, who's gonna bring some of these insurance companies to Congress and ask them why, you know, did you guys know there was gonna be an increase? And, you know, factoring people coming off of the ACA, and, you know, is that where they decided basically to increase the rates? But
The $800, that's an extra per month, is what you're saying, is that right?
the policy went from 8, 9, 10, 11, 12, 2,600 to 3,400. Same policy.
A month.
A month.
Right.
But luckily before that I had the ACA. Now the policy itself, when this started in 2021, because after the first 5 months in 2021, then I think the bill passed, so we were getting it after that.
Right.
But my family of 5 back at that time for those 5 months was we were paying $2,000. Now, in 5, well, 6
That was
years.
with the credits.
No. I wasn't getting it before, but we
Right.
were paying $2,000. Then we got the credit, and then it dropped down.
Okay.
But from 2000, you know, from, you know, past 5 years, from 2000 now to $3,400, that's $1,400.
Right.
That's a huge jump. So you figured in worst case scenario, I get in an accident and I'm paying 40,000, and then my max out of pocket is 20. I'm looking at 60,000, and, you know, being in the hospital. Knock on wood, it doesn't happen, but that's what I'm looking at. So again, now we're hoping everybody figures out. I get into something I can understand because it's all there, because
Right.
of the law, or I go to, you know, just private and try to figure out, you know, hodgepodge of selections I can make, and I hope I make the right one, you know, being non-ACA
And here's the
policies.
thing, it doesn't have to be this way. We have a bill that passed the floor of the House of Representatives. The Senate could take it up and pass it and send it to the president. And it is literally the Republicans who are standing in the way of ensuring that we can get that done. President Trump, you know, he certainly uses whatever influence he has with his Republican members of Congress whenever he feels like it, and they bow to his will. So it is absolutely critical that he care about how much small business owners and regular folks like Steve and his family are paying to make sure that when they're sick, they can afford to go to the doctor. We've had in Florida alone, because we have the most signups for the Affordable Care Act of any state in the country, we've had about 230,000 people in Florida drop their Affordable Care Act coverage altogether from the end of last year to the beginning of this one. And likely, the prediction is that more will drop because some of those are automatic renewals, and so when they realize how much their premiums are, they'll end up dropping they'll likely drop their coverage as well. We should sit down and work together and hammer out a compromise, because if we were all singularly focused on making life more affordable for all Americans, then there's a lot of problems that we could solve together. And so that's what the American people, I know, are looking to hear from President Trump tomorrow, is to talk about how we are going to work together to make life more affordable. He is doing everything but allowing the enhanced premium tax credits to expire, drove healthcare costs through the roof. His tariffs that he has pushed and is so proud of, and is, you know, so incredibly angry at the Supreme Court for throwing out his ability to do that because it was illegal on Friday. I mean, those tariff taxes have increased costs for folks in my district, you know, annually by almost $2,000 a year. I mean, those are taxes. That's what tariffs are. Those costs from businesses are passed on to the consumer. You have grocery prices that are out of control. We should work together to try to find a way to bring those costs down. You know, utility costs are up. I mean, it is affecting everyone, and you know, that's an angst that people live with every single day. You know, when you are constantly worried about, when you're constantly worried about how you're going to afford to take care of your family and make ends meet, then that distracts you from everything else. I mean, childcare costs are hugely expensive. We should be working together. And instead, honestly, as a member of Congress, it feels like I have to put battle armor on every single day when I go to Washington to fight Republicans who seem like they're really, you know, fighting to make the rich richer instead of helping folks like Steve and his family and the middle class folks in my district just to be able to breathe a little easier. It's just not right, and so I'm really glad Steve is joining me to be able to help
you.
show that that you know, this is causing real pain for real people.
Congresswoman, correct me if I'm wrong, but the tax credits, those enhanced premium tax credits, that was from Obamacare, that was from the COVID days, wasn't that right?
It's from the Inflation Reduction Act.
And so they were going to sunset, isn't that right?
Just like the tax cuts in 2017 were
Correct.
sunsetting, and when the Republicans had the big ugly law last summer,
Right.
they prioritized making tax cuts for billionaires permanent, but not the enhanced premium tax credits, which were expiring, and they could have made those permanent, or they could have worked with us to extend them for a few more years.
Some would wonder why you would vote for something that would sunset, that there was a risk of it going away.
Because everything costs money, Steve. I mean, you know, you can't, I mean, when we adopt legislation that has a fiscal impact, we often have an expiration date so that you can manage the costs, just like folks like Steve do. You know, you don't just spend indiscriminately without thinking about the fiscal impact. So we extended those enhanced premium tax credits in the Inflation Reduction Act for 3 more years. You know, at the time, you know, if the further out you extend them, the more expensive and the higher cost it is. So that was what we did at the time, and then you reconsider that. That's what you do. We reauthorize programs all the time. You take a look. Do they need adjustments? You want to make, you know, sometimes that there are different changes that need to be made. And when the Republicans had that opportunity last summer, they really just turned their backs on folks who they knew were going to be priced out of being able to afford health care, and they prioritized making tax cuts for billionaires permanent. Just shows you where their priorities are.
You vote for programs that are going to expire, knowing are going to expire, but you're hoping to come the end, to come toward the sunset.
Most things that Congress votes on that have a fiscal impact have an expiration date, because we limit the fiscal impact. You often have to go back and review the substance of the program, see how it's going, look at what adjustments need to be made. Do we need more funding for something, or is it that you can continue the same funding moving forward? We rarely just automatically make a program with a fiscal impact permanent, because we are trying to manage an already ballooning deficit and ensure that we can be fiscally responsible. I mean, the Republicans didn't have any interest in being fiscally responsible when they made the tax cuts for billionaires permanent, because that blew an even like a $4 trillion hole in the deficit. I mean, how is that more important than making sure that families like Steve's can afford their health care? I know where my priorities are, and the American people can see, and that's why Republicans and Donald Trump's numbers are really in the toilet, because they're unhappy, because Republicans promised they were going to focus on affordability, on making life more affordable for Americans, and they have done the opposite.
All right, thanks, folks.
Thank you, guys. And Steve, thank you. Look forward to seeing you
Thank
in Washington
you.
tomorrow.
Yes, thank you very much.
Thank you.
Congresswoman